Hi, my name is Ashley Morrison, and here's my audience. Many people in today's society have overwhelming feelings of panic and fear, uncontrollable obsessive thoughts, painful intrusive memories, reoccurring nightmares, butterflies in the stomach, hearts pounding, and muscle tension. Anxiety attacks are frightening. Today I'm going to inform you about panic attacks and other types of anxiety. Anxiety affects many people, and it is important that you understand this disorder in case you need to help yourself or help someone you care about who is suffering from anxiety. If you already know about the types and effects of anxiety, then this speech will hopefully increase your knowledge and understanding of this disorder. The more you know, the more you will be able to help yourself and others. There are many resources for anxiety, and it is important to explore these resources before anxiety becomes overwhelming and stressful. If you suffer from anxiety, ask help from a friend or loved one who is compassionate and aware of this disorder. If you know someone who has a type of anxiety, be sure to help in any way possible. There are several types of anxiety disorders, including panic disorder, which is a feeling of panic that happens suddenly and over again without warning. Social anxiety disorder, which is an overwhelming feeling of fear of being judged by others or behaving in a way that could cause embarrassment during everyday social situations. Specific phobias, which is an extreme fear of a specific object or situation that could cause a person to avoid common everyday situations. And there is also generalized anxiety disorder, which is an excessive, unrealistic worry, even if there was little or sometimes no cause for the anxiety. Now that you know some of the types of anxiety disorders, I'd like to tell you about how many people are affected in the U.S. According to the National Institute of Medical Health, anxiety affects 40 million adults in the United States, ages 18 and older, and women are 60% more likely than men to experience an anxiety disorder over the course of their lifetime. Also, according to Anxiety and Depression Association of America, anxiety disorders are one of the most common mental health issues on campus, and 75% of the 40 million adults that suffer from anxiety disorder have their first attack by the age of 22. And lastly, I would like to tell you about the different types of treatments for anxiety. If you think you have an anxiety disorder, talk to your doctor right away for the best chance at recovery. With the right treatment, many people with anxiety disorders can lead normal lives. If your doctor agrees that you have an anxiety disorder, the next step, according to National Institute of Mental Health, would be going in for psychotherapy, which is a type of counseling with a mental health professional, and they can help the patient by talking through strategies to help understand and deal with this disorder. And one type of therapy is interpersonal therapy, which focuses on behaviors and interactions a patient has with friends and family. And interpersonal therapy can improve communication skills, self-esteem, and can resolve mental illnesses caused by loss, relationship conflicts, and role transitions. The other type of therapy is cognitive behavioral therapy, which helps people with anxiety to change false perceptions they have of themselves and the world around them. Therapy is a treatment that tackles specific causes of mental illness, but it's not a quick fix. There are also medications that can be taken to reduce symptoms. Therapy can help more in the long term, but choosing the right medication medication dose, and treatment plan are based on a person's individual needs under an expert's care. Today I informed you about panic attacks and other types of anxiety. I told you about the types of anxiety in the United States and the different treatments for anxiety. Although you're not a mental health professional, there are ways you can help friends or loved ones who suffer from anxiety. The first step is having knowledge of this condition, which I have told you about today. There is a quote by George Eliot: "We do what we do live for, if not to make the world less difficult for each other." Remember to help those who suffer from anxiety, no matter how small. Your help will not be wasted. Thank you.